Watch your mouth.
All right, welcome back. We once again have Dr. Ron Walker in the house. He's our HTV dental expert, and always good to see him. And Doc, good to see you. How are you?
Good to see you, Martin. I'm doing great.
All right, we're going to talk about cosmetic bonding. Me and you've talked about this quite a bit. It seems like a lot of people go to that now, and in the past it was hard to get or very expensive to get. Now more and more people are getting that, aren't they?
Yeah, it's pretty common because it's just very easy. It's easy to do. Sometimes it doesn't take any anesthetic at all. Anytime you have just any little thing you don't like about your smile, people sometimes later on in life, they just take a look at pictures and go, you know what, I've been dealing with this for my whole life. How hard is it to fix? What are my options? And it's just simple bonding that can be used to fix a shade problem. Maybe you don't like the color, maybe a little rotation of a tooth, maybe just something to balance out the smile, a little extra length, a little more fullness, anything. Just
Is it normally multiple teeth?
Usually it's 2 to 4 teeth, something like that. Yeah, it's not going to be like a whole smile makeover kind of a thing. It's just something to just subtle adjustments that just make a big difference to the person in their smile.
Like if somebody has a mole in their face and they decide when they're 25, hey, I want to go get rid of the mole.
That's right.
I can go fix my teeth.
Exactly.
Now, does this require any of the tooth structure to be removed?
Nope. This is usually just additive, right? We're just adding some tooth-colored filling material to the tooth, and sometimes it just makes a huge difference.
Okay. Now, suppose somebody's watching and they're thinking about doing it. Should they whiten before they get a cosmetic bonding?
Yep, it's a great question. It's something a lot of patients ask, and the answer is yes. We want you to go ahead and whiten your teeth before. We'd really like you to stop bleaching about 2 weeks before you have the procedure done to let everything kind of balance out. But go ahead and bleach before, because the shade that we're going to match, I want your teeth to be bright if we're going to match a shade.
Now, a lot of people that we grew up with, I might have been one myself, I don't even remember, but have a space between their teeth. First of all, what is that called?
So in dental terms, the space is called a diastema.
Okay.
But it's just space. If you have some spacing between your teeth, that's something else that's really simple to fix. It looks like that. If you don't like it, getting something done about it. It's really not that big of a deal to close a space like that. And it makes all the difference in the world to the patient. As far as their smile, it makes a big difference.
And they're better whistlers, though, right?
Right.
If I could add a little humor to it, but anyway, so what would you say now on a normal basis for someone like in your practice? I know you see a lot of people just make sure you keep your teeth semi-regular, this and that. But are you seeing a lot more of this cosmetic?
Well, it's something that I ask new patients: is there anything you don't like about your smile? Right? And some patients are very reluctant to say it, but some patients will come out and say, yes, that's why I'm here. This right here has been bothering me forever. What can I do about it? Mm-hmm. And sometimes it just takes a little bit of bonding to make all the difference to that patient.
Yeah. And all they need is a little assurance from you that it's easy to fix.
Right. Exactly. And the best thing about it is that we're not reducing any tooth structure. I'm adding. If you don't like it, or you want to change it or trim it, I can take it off.
Yeah.
We'll take it completely off. It's right back to your natural tooth, and no harm's done.
Let's look at some before and after pictures if we can. There you go.
Yeah. So what we call the laterals, okay, everybody knows what the front teeth are. We call those central incisors, but the laterals are the incisors on each side of the front teeth. And this is, post-orthodontic treatment. Somebody that just says, you know what, I think that I just want it to be a little more full. I think it would really balance out my smile. And we just added a little resin to them and just filled out those teeth a little bit and just made her smile a little more full.
The most subtle difference can mean the world.
Yes, to the patient. Yes.
Absolutely. All right, let's take another look if we can.
So this is very similar to the same thing. This is post-orthodontic treatment, after you get your braces off. And sometimes orthodontists just can't get it exactly right. And sometimes there's a little rotation. You see on that left side that lateral incisor is a little rotated to the front. The back ones doesn't look as wide. So we just added to those laterals and just filled them out a little bit. And to the patient, it means all the difference.
You ever thought like of being a duck carver when you were growing up? You got to be good with your hands to do this kind of stuff.
No. Yeah, you got to be good with your hands. But no, I like working on teeth.
No, I know. I'm just picking on you. But it's a talent to be able to sculpt.
It's really
and do
fun.
that,
It's
yeah.
really fun, and the patients when I'm more critical than anybody on myself, and
Mm-hmm.
when they're done, I say, okay, we're gonna sit you up and let you look at it, and you tell me how you want me to adjust it or make adjustments or anything like that, and then I'm waiting for them to say something, and they go, looks great, it's great, all right, I'll take it, all right, great.
Very good. All right, let's look at another slide if we
Let me
can.
do
Jay will bring up. There you go.
Yeah. So here's a gentleman that this is a wear pattern from grinding your teeth on that left side. He just had that little uneven edge, and he's been dealing with that his whole life. And he said, you know what are my options? I'm tired of looking like this in pictures. And very easily we just added some filling material to it, and it just balanced it out.
Looked
and
good.
he was really happy about it.
All right, let's look at another one real quick if we can. Jay, shade.
Oh, and that's just showing the shade picks. That's just showing, like, when you go to pick your filling material, this is what the bleaching's all about. You want the teeth to be stable, and this is really like picking paint in your house. We got tons of different shades of filling material, and you see the little bulks there. There's two different shades there. We just put it on there before we do it, make sure the shade matches, and say, okay, this is blending well, and we pick a shade and go from there.
All right, Dr.
That's
Ron
it.
Walker, thank you so much. And I learned a new word today, diastema.
I asked him. That's
All
it.
right, there you have it, Dr. Ron Walker, dental expert here at HTV. And once again, thank you for joining us, and get that checkup. He's a good guy.
Watch your mouth.